Did you know that the first vaccine was made in 1796? A man by the name of Edward Jenner created the first vaccine to protect people from smallpox. This vaccine saved countless of lives by getting rid of smallpox. Over the years, his method would eventually lead to the eradication of smallpox. Over time, advances in science and technology led to the development of more vaccines, including those that fight against devastating diseases like polio, measles, whooping cough, and mumps. So, how do vaccines work? Our immune systems are built to fight off diseases using proteins called antibodies. Vaccines train our immune systems to make antibodies so that we are ready to fight off a disease should we become exposed to it. There is no living virus in the new COVID vaccines that can cause COVID-19. The U.S. Food and Drug Administration makes sure all food and drugs are safe. COVID vaccines have been through all the proper testing to ensure safety and effectiveness. VSafe is a new app provided by the CDC. With VSafe, you can quickly tell the CDC if you have any side effects after your doses. Here are some common myths and facts about the COVID-19 vaccines.
Well, the COVID-19 vaccine was just made way too quickly. We can't trust its safety and effectiveness.
The available COVID-19 vaccines, which include Pfizer, Moderna, Johnson & Johnson, have all gone through the usual rigorous testing protocols to ensure its safety and effectiveness. There are many reasons why these vaccines were able to be developed quickly, such as the availability of adequate funding and resources, available research and technology on mRNA, and prompt isolation and sharing of the COVID-19 genetic information.
Okay, well, that may be the case, but COVID-19 vaccine will give me COVID-19, so why am I going to get it?
The COVID-19 vaccines do not contain the live virus, so you cannot get COVID-19 from it.
Okay, so it doesn't have the live virus, but it'll change my DNA.
The COVID-19 vaccines are made from messenger RNA, which do not enter the nucleus of the cells where DNA resides. The mRNA is given instructions to make a protein to stimulate your immune system and then gets broken down without ever affecting your DNA.
All right. So I've already had COVID-19, so I don't even need the vaccine anyway.
Vaccination is still recommended, even if you've had COVID-19, due to the risk of reinfection. Some studies also show that the vaccines may offer better protection than natural infection.
So I guess the good thing is if I receive my vaccine, at least I can stop wearing a mask.
Wearing masks and following the other guidelines is still necessary. We do not yet know if the vaccines prevent getting or transmitting the virus, only that it protects against moderate to severe illness. It is important to continue following current guidelines until enough people get vaccinated to lower its spread.
Well, that's all good and everything, but I can't even afford it. I don't even have insurance.
The vaccine is free for everyone, regardless of your insurance status.
Okay, that's all well and good, but my wife and I were trying to start a family. Doesn't it affect fertility?
The COVID-19 vaccine will not affect fertility, including those who are undergoing reproductive assisted technology.
Yeah, well, did you know that if you get this vaccine, then there's tracking devices in it? I'm not going to be tracked.
The COVID-19 vaccines contain no tracking devices, microchips, or implants. They also contain no eggs, preservatives, fetal tissue, stem cells, mercury, latex, thimerosal, antibiotics, or adjuvants. Their only ingredients are mRNA, salt, sugar, and fat.
Wow, I guess I didn't know as much as I thought I did. I appreciate the help. Thanks.
The mission of Compassion Healthcare Incorporated is to provide excellent patient-centered healthcare to all. Our vision is for healthy people, healthy communities.